What's the best type of exercise? That's a question we get asked frequently in clinic, and unfortunately there isn't a simple answer. It's a bit like asking what's the best type of food or what's the best type of music. If you're a hairy biker, you may well prefer heavy metal. If you're a more refined, sophisticated type, you may like classical music. There's no right or wrong answer. But there certainly are some guidelines that we can use to try to determine what's the most appropriate form of exercise to achieve a particular objective. If difficulty in movement and lack of flexibility and fluidity of movement is your primary sensation that you feel, well then an exercise system that's geared towards restoring flexibility would be more appropriate. So something like yoga or a customized stretching regime done in your own environment, structured according to your specific needs, is the most appropriate thing to do. And you need to be doing that probably over 2 or 3 sessions a week, certainly initially, to try and regain lost flexibility. Once you've regained the movement, you may not need to work as intensively on it, but it does take that kind of intensity to try to regain lost range that may have accumulated over many months or years. If your primary issue is to gain muscle strength, and when I say muscle strength, for the vast majority of people, I'm talking about functional strength, enough muscle strength to support our body weight in different combinations of positions and for different activities that we tend to do on a day-to-day basis. There's a minimum basic requirement that your muscles are able to withstand the weight of your body. So often when we discuss weight training, people have an image of bodybuilders and heavy weightlifters chucking iron around in the gym. And generally speaking, unless we're trying to refine that specific skill, it's not what we're looking for the vast majority of people. It's really about body weight activities. And as most patients that we introduce to bodyweight exercises realize, your body weight can be more than humbling, particularly if exercises are structured in a particular way to expose strength deficits. So strength deficits need to be diagnosed, and very often people will present with a painful movement, and the assumption is that there's something wrong in the joint, whether it's a knee or a hip or a spine. But actually the reason why it's painful is that the muscular system is not supporting the area, and therefore more vulnerable, and putting more pressure on the tissues, which can either just temporarily irritate them or cause some inflammatory response. So working out whether the cause of pain is a flexibility deficit or a strength and control deficit or a movement pattern dysfunction, they're all the job of a skilled physiotherapy assessment, which really that's the objective, to drill down in the physical examination and then structure a specific corrective program around that. Of course, a lot of people now enjoy Pilates type classes because they're very safe and controlled, and there's no impact loading with them. So that's become a very popular kind of activity to promote folks with muscle strength deficits. So that's something that we would recommend to folks. Now, if a lot of people maybe struggle with the time to commit to that type of a class, so you can certainly condense the kind of components that are involved in a Pilates strengthening program into a bodyweight home exercise program, and we usually aim to target 15-20 minute self specific kind of programs that people can do at home, provided they feel they have the discipline to do that. The other kind of exercise, of course, is exercise for weight loss, and the original idea on that was that you needed to do sustained activity at a modest intensity, sort of conversation level of effort, 55-60% of maximum heart rate, for between 45 minutes to 90 minutes. The view has changed on that in more recent years, and that needs to be mixed with higher intensity interval training, or HITT, as you'll see referred to if you're exploring this topic on the web. And the reason being that there are different metabolic stimuluses from sustained low intensity activity and intermittent high intensity activity. And in order to maximize weight loss, you need to mix those combination of things. So that's really the take home message there. There are a lot more details involved in that, but just continuous steady state work, unless you're doing very long, like 4 or 5 hour hill walks or prolonged distance running, they're not the most efficient way of trying to lose weight. Of course, in clinic, a lot of times we see folks who are struggling with mechanical issues in hips or knees or spines that are limiting their ability to do weight loss type of activity. So a significant amount of our work is spent on trying to rehabilitate or maximize the function in areas where there might be compromise, in order to allow people to get into sort of a more generalized kind of activity or pastime. And that really, I suppose, is the crux of it, that you need to find activities that give you pleasure, because it's very hard to consistently work on a program that you don't find enjoyable. Now, sometimes it's a case of backs to the wall, like brushing your teeth isn't necessarily particularly enjoyable, but if you have a bit of degenerative change in your lumbar spine or hip, you might need to do some maintenance stretching on that a couple of times a week, and if you don't do it, it'll start to get sore. So it's not that it's a particularly pleasurable activity, but the downside of not doing that is that you get sore. So there's a very clear relationship between maintaining function with some specific work, and then an exacerbation of symptoms if you don't. If you don't feel a clear benefit from the activities you're doing, then I guess it does question whether it's the most specific thing for what you need. We'd very frequently in clinic see people whose primary problem is lack of strength, but their exercise of choice is something like a stretch focused yoga program. Now, some yoga programs will focus on strength and holding poses, which are very much strength related, but some of them are very much more geared towards relaxation and stretching. And somebody who doesn't have a stretching deficit won't gain a lot from that. They may gain from the relaxation component, but not from the stretching element. So again, that's without trying to overcomplicate things, there are just some specific questions that you need to ask as an individual and as a clinician managing a problem. What are your objectives? What are the particular factors limiting your objectives? Can they be improved in order to allow you to do what you want to do? And then is it necessary to do some sort of maintenance program? And the reality is, as time goes by, that generally the degree of self-maintenance does tend to increase a little bit. That's just a fact of life that we need to embrace. One of the quite damning statistics that I'll often tell patients is that the evidence would suggest to us that after the age of 40, most people will lose 2% of their muscle mass each year. And very few people lose 2% of their body weight every year after the age of 40. Now, this can be reversed or arrested if you do structured resistance work, but it's a pretty scary statistic in terms of recognizing that muscle turns to less useful function, i.e. becomes infiltrated with fat and therefore doesn't generate strength and power unless you do something specific to stimulate that. So I suppose that's a fairly lengthy answer to a very short, simple question, but I hope it gives you some idea as to the factors that need to be considered when designing exercise programs and recommending what's the best kind of activity to participate in. Hope you found that informative. I'll see you again in another video. Bye for now.